All right, hello everybody. My name is John Clark. I'm a chiropractor here in Uxbridge, Ontario, and I wanted to do a video today about spinal pain. Chiropractors are known for their ability to treat spinal pain, and just wanted to start by talking about two different categories of back pain. 5% of back pain is structural. It's actually a bit less than 5%. Structural problems like disc herniations, severe arthritis, and congenital issues. So thankfully that's a smaller category because obviously structural problems are more difficult to treat. In the worst case scenario, let's say disc herniations, unfortunately some people will need surgery for that, but again the overwhelming majority of people fall into this category, the 95%, which is functional back pain. So most back pain is not structural. There's a problem with the motion of the joints or muscles or fascia, which we'll talk about now. So we'll talk a little bit about some anatomy. If you add up all the joints in the spine, if you include the rib joints, which attach to the spine, believe it or not, there are 159 joints. So that's what chiropractors do. We analyze the function of all those joints. And it's kind of like links in a chain. You have a little length of chain here, and each of those links has to move a little bit relative to the neighboring link. So when you add it all up, we have a decent range of motion. However, if you lose the motion in the joints, that can cause back pain. All right, so middle back pain can be from the thoracic spine or ribs. Lower back pain is often from the sacroiliac joints. That's a key joint at the base of the pelvis that you see right here. Okay, so the sacrum and the ilium, that's why it's called the sacroiliac joint. Very important joints there. If they get out of alignment or if they lose their motion, you can become twisted and your body has to compensate for that. Okay, so by adjusting the joints back into a proper alignment. So for example, the pelvis is kind of like this box. You want it to be level. If it's tilted one way or the other, or forward or back, then the muscles have to compensate. So I wrote the muscles here as well. I didn't list them all because there are hundreds of little slips of muscle in the lower back. And they can become too tight, too loose, too strong, too weak. They can also very, very commonly develop a concept called a trigger point, which is kind of like a knot in a piece of rope like you see here. And the trigger point phenomenon will generate pain, and it can actually send pain. In the example of hip muscles, it can send pain down the leg. So most leg pain, for example, is not from a disc herniation. It's not true sciatica. It's usually coming from the sacroiliac joints or from knots in the muscles. And the third category is an often overlooked tissue called fascia. And fascia is literally everywhere in your body, and it's like a mesh, like you hopefully can see here in front of me. The mesh normally is open, but it can get twisted on itself, and when it gets twisted, it can pinch the little nerves that run through the fascia, and that can cause pain, but it can also cause stiffness, and then the muscles have to work harder, and then the muscles get tight and pull the joints out of alignment. So you can see how all three of these relate to each other. So it really is a functional unit. It's like a machine. So chiropractors, we analyze the mobility of the spine. We look for the trigger points in the muscles. We assess the fascia. Depending on where we find the problems, that will guide us to the treatment. So here we do spinal adjustments, chiropractic adjustments. Here we do work on the muscles. I do a technique called pain neutralization, which is an amazing technique for getting rid of muscle pain. Good for getting rid of pain anywhere, actually, any tissue. And then for fascia, I use a technique called gua sha, which is a Chinese technique. Sometimes I'll also use acupuncture for tight muscles. We use stretches, et cetera, et cetera. So all these techniques are designed to increase function. So inevitably, as function goes up, you're going to cross the pain threshold. Okay, so that's why I say most back pain is functional. So if you've been told that you have back pain, well, you obviously know it if you have it, but maybe you were told it was a structural problem, or maybe you were told it was arthritis. Only in severe cases does arthritis actually cause pain. So if you have an x-ray that showed a little bit of arthritis or even a moderate amount of arthritis, That does not mean you have to live with that pain. Again, if you improve function, you'll cross the pain threshold. So that's what we do. We improve function to get rid of your pain. So if you're suffering with back pain, neck pain, middle back pain, shoulder pain, rib pain, hip pain, we can fix that for you. Okay, it's just a matter of improving function. So thanks for listening, and somewhere on the screen you'll see my phone number. Give us a call and we'll get you back on the road to recovery.